Your body has no flashing lights or sirens like a car dashboard. Instead, it whispers warnings through subtle symptoms. The danger is that whispers are easy to miss, but ignoring them can cost you your life. Signal 1: chest pain or pressure. Chest pain, tightness, or discomfort is one of the most universal warning signals the human body can produce. It's also one of the most misunderstood. People imagine that if something is seriously wrong with the heart, the pain will be sharp, unbearable, and dramatic. But the truth is more complex. In reality, heart-related chest discomfort is often vague, mild, and deceptive, and that is precisely why it can be so dangerous. Let's start with how it feels. Chest pain can present in a variety of ways. For some, it's a crushing pressure, as if an elephant were sitting on their chest. For others, it's a dull ache that comes and goes, a bit like muscle soreness. Some people experience it as a burning sensation, so similar to heartburn that they reach for antacids, convinced it's just indigestion. Still others notice it as a strange tightness, like wearing a vest that is 2 sizes too small. The range of sensations makes it easy to dismiss or misinterpret. Imagine a smoke detector that sometimes rings loudly, sometimes just beeps softly, and sometimes only flashes a light. If you aren't paying attention, you might assume nothing is wrong. But in each case, the detector is still warning you of danger. Your chest discomfort is that detector. Now let's explore why this signal matters so much. Your heart is a relentless worker. It pumps about 70 milliliters of blood with each beat, over 100,000 times a day. In the course of a year, that adds up to over 35 million beats. To accomplish this, the heart muscle relies on a constant stream of oxygen and nutrients delivered through the coronary arteries. But when those arteries become narrowed by cholesterol plaque, or blocked by a clot, blood flow slows or stops. The heart muscle, deprived of oxygen, begins to suffer almost immediately. Within minutes, cells start to die. The sensation you feel in your chest, pressure, heaviness, or pain, is the heart screaming for help. Studies confirm the importance of this signal. In a large survey of heart attack survivors, over 50% reported experiencing chest discomfort in the days or weeks leading up to their event. Yet many ignored it. Some thought it was indigestion, others assumed it was stress, and some simply hoped it would disappear on its own. Tragically, in many cases, the delay in seeking medical help cost them precious time. In heart disease, minutes can literally mean the difference between survival and catastrophe. It's also worth noting that chest pain does not always follow the same pattern in everyone. Men often describe the classic symptom of heavy chest pressure radiating to the left arm. But women are more likely to have atypical symptoms: mild pressure, fatigue, nausea, discomfort in the jaw, neck, or even the back. This difference leads to underdiagnosis in women, who are sometimes told their symptoms are just anxiety or just stress. Sadly, many women suffer worse outcomes because their signals were underestimated. So, what should you do if you experience this kind of discomfort? The most important rule is, take it seriously every single time. If the pain is sudden, intense, or spreading to other parts of the body, the arm, shoulder, jaw, or back, call emergency services immediately. Do not try to tough it out. If the discomfort is milder but keeps recurring, do not postpone a medical evaluation. Schedule an appointment with a doctor. They can perform tests like an electrocardiogram, ECG, stress test, or blood analysis to see if your heart is under strain. It is true that not all chest pain is cardiac. Sometimes it's acid reflux, sometimes it's anxiety, sometimes it's simply a pulled muscle. But here's the catch: only a doctor can make that determination safely. Trying to guess on your own is like flipping a coin with your health. Would you gamble with your life savings? Then don't gamble with your heart. Let me give you a real-world analogy. Imagine you're driving a car, and suddenly the check engine light turns on. You could ignore it, hoping the car keeps running. Maybe it's nothing serious. But maybe it's the sign of a critical problem that will leave you stranded on the highway. Most people take their car to a mechanic just to be safe. Your heart deserves the same, in fact, more attention than a machine. In hospitals, doctors often hear patients say, "I didn't want to bother anyone," or "I thought it would go away." Unfortunately, for some, that hesitation is the reason they don't make it to the hospital in time. On the other hand, those who call for help quickly, even if it turns out to be something less serious, often save their lives. Remember, it is never embarrassing to be cautious about chest pain. Doctors would rather rule out a false alarm than treat a heart attack that has already progressed. Finally, think of chest pain as your body's way of handing you a warning note. It's saying, "Pay attention. Something might be wrong." If you listen, you give yourself the chance to act before disaster strikes. If you ignore it, you silence the only alarm system you have. So, chest pain or pressure, whether it's sharp, dull, burning, or heavy, is one of the most serious signals you should never ignore. Treat it as urgent, act on it quickly, and you may very well save your life. Signal 2: Shortness of breath. Shortness of breath is one of the most underestimated warning signs in medicine. People rarely take it seriously because breathing problems don't always cause pain. Pain demands attention. Difficulty breathing can sneak up quietly, gradually, until one day it becomes impossible to ignore. Yet, shortness of breath can be a loud alarm bell that something is dangerously wrong with the heart or lungs. Let's step back and think about breathing. Most of us never give it a second thought. From the moment we are born, our lungs expand and contract, and our diaphragm pulls air in and out, about 20,000 times a day. Breathing is automatic, silent, and reliable. You can go days without food, hours without water, but only minutes without oxygen. That is how vital breathing is. So when your body suddenly makes you aware of it, when a simple task like tying your shoes or walking across a room leaves you gasping, you should listen. Many people dismiss breathlessness as being out of shape or getting older. They slow down their pace, they take the elevator instead of the stairs, they avoid long walks, convincing themselves nothing is wrong. In reality, these adjustments are often silent compromises, ways of adapting to a weakening heart or struggling lungs. Instead of solving the problem, they hide it. Why does shortness of breath occur when the heart is involved? The explanation is simple but powerful. Your heart is a pump. Its job is to deliver oxygen-rich blood from your lungs to every corner of your body. If that pump weakens, blood backs up. Instead of flowing forward, it leaks backward into the lungs. Imagine trying to breathe while water slowly fills your airways. That is essentially what happens in heart failure. The medical term is pulmonary congestion. Patients describe it as trying to breathe through a soaked sponge, or as if they're drowning on dry land. Another cause is narrowed coronary arteries. When they are clogged, the heart muscle itself becomes starved of oxygen. As a result, even mild exertion, carrying groceries, walking up a single flight of stairs, or bending over to tie a shoe, can leave you breathless. The body demands oxygen, the heart can't supply it. That mismatch translates into the terrifying sensation of not being able to catch your breath. Shortness of breath can also follow distinct patterns that are red flags. For example, exertional breathlessness, feeling winded after very little activity, orthopnea, finding it hard to breathe while lying flat, needing multiple pillows to sleep, paroxysmal nocturnal dyspnea, waking up suddenly at night gasping for air. Each of these patterns strongly suggests heart dysfunction, and yet people often dismiss them. They say, "It's just age," or "I must have eaten too much dinner." In truth, these are classic warning signs of heart failure. Let me illustrate with a story. A middle-aged man noticed he had to pause halfway up the stairs in his own home, something that never happened before. He assumed he was out of shape and promised himself he would start exercising. But over the next few weeks, he began sleeping propped up with extra pillows, because lying flat left him short of breath. Finally, one night he woke up gasping, drenched in sweat, terrified. When he went to the hospital, doctors told him he was in advanced heart failure. The signs had been there for months. He simply ignored them. His story is not unique. It is tragically common. Statistics confirm how dangerous this can be. Studies show that people who report new-onset unexplained breathlessness are at a significantly higher risk of developing cardiovascular events within the next few years. In fact, some researchers argue that unexplained shortness of breath should be treated as seriously as chest pain when it comes to screening for heart disease. Of course, not all breathlessness is cardiac. Asthma, lung infections, chronic obstructive pulmonary disease, anemia, and even anxiety can cause similar symptoms. That is exactly why it is risky to assume you know the cause. The overlap is too great. A cough might be just a cold, or it could be pneumonia. In the same way, breathlessness might be mild anxiety, or it could be heart failure. Only proper evaluation can tell the difference. Doctors rely on tests to untangle the mystery. An electrocardiogram can show if the heart rhythm is normal. An echocardiogram uses ultrasound to measure how strongly the heart pumps. Blood tests can detect markers of strain, such as BNP, which rises when the heart is failing. Chest X-rays can show fluid in the lungs. Pulmonary function tests measure how well air moves in and out of your lungs. Each of these tools helps reveal the truth behind shortness of breath. Now let's think about the psychology. People are more likely to seek help for pain than for fatigue or breathlessness. Pain feels urgent. Breathlessness feels vague. This difference costs lives. Emergency physicians often hear the same regretful words from patients after a diagnosis of heart disease. "I thought I was just tired." Or, "I thought it was nothing." By the time they realize it was something, their heart has already been damaged. So what can you do? The first step is awareness. Pay attention to changes. If walking a short distance leaves you more winded than before, that is not just normal aging. If lying down makes breathing harder, take it seriously. If you wake up in the night gasping, do not brush it off. The second step is action. See a doctor. Even if the cause turns out to be minor, you will have peace of mind. And if it is serious, you will have caught it early, when treatments are most effective. Remember, modern medicine can do amazing things. Medications that reduce fluid buildup, devices that help the heart pump, even surgeries that restore blood flow. But none of these can help if you never seek care. Finally, think of breathlessness as your body's built-in alarm system. It doesn't ring without a reason. You wouldn't ignore a smoke detector beeping in your home. You wouldn't silence a car alarm going off in the middle of the night. Treat your own breath with the same urgency. When breathing, the act that sustains life itself, becomes difficult, it is not a small inconvenience. It is a signal that demands attention. So, shortness of breath is not just being tired or out of shape. It is your body's cry for oxygen, for relief, for help. Listen to it. Respect it. Act on it. Because ignoring it could cost you your health or your life. Signal 3. Unexplained fatigue. Fatigue is one of the most common human complaints. Everyone feels tired sometimes. After a long day at work, after too little sleep, after a stressful week, tiredness seems natural. But there is a crucial difference between normal tiredness and the kind of unexplained, persistent fatigue that signals something much deeper is wrong. Let's define it clearly. Normal fatigue is proportional. If you run a marathon, you expect to be exhausted. If you stay up until 3 a.m., it makes sense to feel drained the next day. But unexplained fatigue is disproportionate. It strikes even when you haven't exerted yourself. It lingers for days, weeks, sometimes months. It doesn't improve with rest. People describe it as a heaviness, a fog, a constant weight dragging them down. Why is this so important? Because unexplained fatigue can be one of the earliest signs of serious illness, particularly heart disease. When the heart can't pump efficiently, less oxygen reaches your muscles and organs. The result isn't always pain. Sometimes it's simply overwhelming tiredness. Your body is running on low power, like a phone stuck in battery saver mode. Studies have shown that fatigue is especially common as a warning sign in women with heart disease. In fact, some women never experience chest pain before a heart attack. Instead, they feel weeks of profound fatigue. They find themselves unable to finish household chores, struggling to get through a workday, or needing to nap constantly. Because society often expects women to juggle multiple roles, this fatigue is too often dismissed as stress or overwork. But in reality, it may be the heart's cry for help. Let me share an example. A woman in her 50s began noticing that everyday tasks left her exhausted. Cooking dinner made her sit down halfway through. Walking to the corner store felt like climbing a mountain. She told herself it was just menopause or just getting older. But one morning, after feeling especially drained, she went to the doctor. Tests revealed severe coronary artery disease. The fatigue she had been ignoring was the only warning sign her body gave. By acting before a heart attack struck, she was able to receive life-saving treatment. Fatigue can also be linked to other dangerous conditions: anemia, thyroid disorders, diabetes, even certain cancers. That's why unexplained tiredness is such an important signal. Your body is essentially telling you, "I cannot keep up." Ignoring that message is like ignoring a red light on your dashboard. Let's talk about the difference between lifestyle tiredness and warning signal fatigue. A lifestyle tiredness improves with rest. A good night's sleep, a weekend off, or a vacation helps restore your energy. A warning fatigue does not improve. No matter how much you sleep, no matter how many breaks you take, you still feel drained. A lifestyle tiredness comes after exertion. A warning fatigue arrives without reason, sometimes even first thing in the morning, before the day begins. Another important detail: fatigue often comes hand in hand with other subtle symptoms. Maybe you notice mild shortness of breath. Maybe you have less appetite. Maybe you're more irritable or unable to concentrate. These combinations strengthen the case that something systemic is happening. Doctors approach unexplained fatigue very seriously. Blood tests can reveal anemia or thyroid problems. Cardiac tests can show whether the heart is pumping strongly. Sleep studies can uncover sleep apnea, a condition that not only causes fatigue but also dramatically raises the risk of heart disease. It is tempting to ignore fatigue because it doesn't hurt. Pain pushes people into action, tiredness just whispers. But in medicine, whispers can be just as deadly as shouts. Persistent fatigue is often the first domino to fall in a chain of events leading to major illness. Let's use an analogy. Imagine your smartphone. Normally, you charge it overnight and wake up with 100% battery. But suddenly, one morning, it's at 30% even though you charged it fully. You'd notice right away and you'd investigate: is it the battery, the charger, the system? You wouldn't just keep using it until it died. So why, when our own body shows the same pattern, waking up drained, energy depleting too fast, do we ignore it? Our body is more important than any phone. Another layer: psychological impact. Chronic fatigue doesn't just sap energy, it steals joy. People stop doing hobbies, withdraw from friends, lose motivation. They may even slip into depression. But sometimes the root cause isn't psychological, it's physical, often cardiovascular. That is why mental health treatments alone won't solve the problem if the true issue lies in the heart. The takeaway is simple: unexplained fatigue is not laziness. It is not weakness. It is not just stress until proven otherwise. It is a signal, a warning that deserves investigation. If you feel constantly drained without explanation, don't dismiss it. Seek medical help. Tests might reveal a simple cause, easily corrected. Or they might uncover something life-threatening that can be treated before it's too late. Unexplained fatigue is one of those signals people often put at the bottom of their priority list. But in reality, it belongs at the top. Because your energy is life itself. When your body cannot generate enough of it, that is not normal. It is a red flag waving urgently, saying, "Pay attention to me." Signal 4. Dizziness or fainting. Dizziness is one of those symptoms that people brush off all too easily. "I just stood up too fast. Maybe I didn't drink enough water. It will pass." And sometimes that is true. Dizziness can be harmless, related to dehydration, low blood sugar, or a quick change in posture. But when dizziness or fainting happens repeatedly, without a clear explanation, it can be a powerful signal that something serious is going on with your body, particularly with your cardiovascular system. Let's imagine what dizziness really means. When you feel lightheaded, when the room seems to spin, or when you suddenly feel unsteady, your brain is telling you it isn't receiving enough oxygen or blood flow. The brain is an incredibly sensitive organ. It makes up only 2% of your body weight, but it consumes about 20% of your oxygen. If blood flow drops even slightly, the brain reacts instantly, producing dizziness, blurred vision, or even a blackout. One of the most common cardiovascular causes is arrhythmia, an irregular heartbeat. Normally, the heart pumps in a steady rhythm, ensuring the brain and body receive a constant stream of oxygen-rich blood. But when the rhythm falters, beating too fast, too slow, or chaotically, blood flow can become inconsistent. That sudden drop is enough to make you feel dizzy or faint. Some arrhythmias are benign. Others are life-threatening, leading to cardiac arrest if untreated. Another dangerous cause is low blood pressure, especially if it drops suddenly. Your blood pressure is like the water pressure in a hose. If it falls too low, the stream slows down. In the body, that means less blood to the brain. This can happen with dehydration, yes, but also with heart failure, internal bleeding, or shock. Ignoring repeated episodes of lightheadedness could mean ignoring a ticking time bomb. Fainting or syncope is the more extreme version. It happens when blood flow to the brain is interrupted long enough that the brain literally shuts down for a moment, forcing you to collapse. In some cases, fainting is relatively harmless, like when someone faints at the sight of blood due to a sudden vagal nerve reaction. But fainting without an obvious trigger, especially during exertion, is a huge red flag for serious heart disease. For example, it can indicate aortic stenosis, a narrowing of the heart's main valve, hypertrophic cardiomyopathy, or dangerous arrhythmias. These conditions have been linked to sudden cardiac death, especially in young athletes who collapse unexpectedly during sports. Stories from real life underline the importance of this signal. A teenager faints while playing basketball. Doctors later discover an undiagnosed heart condition that could have been fatal if ignored. An older adult faints while walking the dog, thinking it's just age. A checkup reveals severe aortic valve narrowing that required urgent surgery. In each case, dizziness or fainting was not the problem itself, it was the body's way of pointing to a deeper, hidden problem. Now let's talk about the subtler forms. Sometimes dizziness doesn't cause full fainting, but it recurs often. People describe it as feeling foggy, off balance, or as if their head is light and empty. They may avoid standing quickly or walking long distances because they fear falling. These small adjustments can mask a serious underlying illness. If the cause is cardiovascular, no amount of taking it slow will solve the problem. It's also important to remember that dizziness can interact with other signals we've already discussed. Imagine unexplained fatigue combined with dizziness. That's not just tiredness, that's possibly the heart struggling to supply the brain. Or shortness of breath plus dizziness. That could indicate advanced heart failure. The combination of symptoms often paints the clearest picture. Doctors take fainting very seriously. Even a single unexplained episode usually warrants tests. Electrocardiogram, echocardiogram, Holter monitor, 24-hour heart rhythm tracking, tilt table test, and blood work. These tools help determine if the problem lies in the heart, the blood vessels, or the nervous system. Too often, people dismiss fainting because they came around quickly. But the few seconds you were unconscious represent a complete loss of brain blood flow, and that should never be ignored. Let's use an analogy. Imagine your home loses electricity for even 30 seconds. All the lights go out, devices reset, alarms start beeping. Even if the power comes back quickly, you'd want to know why. Was it a blown fuse, a storm, a bigger problem with the grid? You wouldn't just shrug and hope it never happens again. Your brain fainting is the same. It lost power. You need to know why. The psychological impact is also worth mentioning. People who faint once often feel embarrassed and don't seek care. They say things like, "I don't want to overreact," or "it only happened one time." But embarrassment is not worth the risk of a missed diagnosis. Doctors would always rather investigate and find nothing than ignore something that could be fatal. Practical advice: if you ever experience sudden dizziness accompanied by chest pain, shortness of breath, or palpitations, treat it as an emergency. If you faint without explanation, do not delay, see a doctor immediately. And if you have frequent unexplained dizziness, don't accept it as just getting older. Age may bring some changes, yes, but repeated dizzy spells are not normal aging. They are a symptom. In conclusion, dizziness and fainting are not just quirks of the body. They are the brain's cry for oxygen, the cardiovascular system's way of saying, something isn't working right. Ignoring them is like ignoring a flashing warning light on the most important system in your body. Respect the signal. Investigate it. Because sometimes, that moment of lightheadedness is the only warning you'll ever get before something far more serious happens. Signal 5, unexplained swelling. Swelling might seem harmless at first. Many people notice their shoes feeling tight at the end of the day, or see marks on their ankles where socks dug into the skin. They shrug it off as just standing too long or normal water retention. But persistent, unexplained swelling, especially in the feet, ankles, legs, hands, or even around the abdomen, is a signal that should never be ignored. Why does swelling matter? Because swelling, or edema, often reflects a deeper problem with circulation. When the heart, kidneys, or liver are struggling, fluid doesn't move through the body the way it should. Instead, it leaks out of blood vessels and accumulates in the tissues. The result is puffiness, heaviness, and sometimes visible indentations if you press the skin, a sign doctors call pitting edema. One of the most common cardiovascular causes of swelling is congestive heart failure. When the heart can't pump blood effectively, pressure builds up in the veins. That pressure pushes fluid out into the tissues, especially in the lower body where gravity pulls it down. People often notice their ankles ballooning by evening, or find they need larger shoe sizes than before. Left untreated, this swelling worsens, spreading to the legs, abdomen, and even the lungs. Another serious cause is kidney disease. The kidneys act as the body's filters, removing excess fluid and waste. If they are damaged, fluid builds up everywhere, not just in the legs but also around the eyes and face. Similarly, liver disease can cause swelling in the abdomen, ascites, as blood flow through the liver is obstructed. But whether the cause is cardiac, renal, or hepatic, the underlying message is the same. Something critical is failing. It is important to recognize how subtle this signal can begin. At first, the swelling might be minor, just a little puffiness around the ankles after a long day. You may tell yourself it's nothing. But over weeks or months it gets worse. Suddenly, pants feel tighter, rings no longer fit, weight increases without any change in diet. That water weight is not cosmetic, it's a warning. Research highlights the importance of paying attention to edema. Studies of heart failure patients show that swelling is one of the most consistent early signs of disease progression. In fact, weight gain from fluid retention is often the first clue that the heart is weakening, sometimes appearing weeks before a hospitalization is required. Doctors even recommend that patients with known heart conditions weigh themselves daily, because a sudden increase of just 2 to 3 pounds can mean dangerous fluid buildup. Let's imagine how it feels in daily life. Someone notices their socks leaving deep grooves in their skin, but they ignore it. Over time, climbing stairs becomes harder, shoes feel uncomfortable, and clothes feel tighter. They may think they are simply gaining weight, but in reality it is not fat, it is fluid. Their body is sending a loud signal that circulation is compromised. Doctors can determine the cause of swelling with examinations and tests. A simple physical check can reveal whether edema is pitting or non-pitting. Blood tests can check kidney and liver function. Echocardiograms and electrocardiograms can reveal heart failure. Ultrasound can detect clots that block circulation in the legs, deep vein thrombosis. Each of these investigations turns a vague symptom into a clear diagnosis. The consequences of ignoring swelling can be severe. Untreated heart failure leads to fluid in the lungs, making breathing difficult. Kidney failure can progress silently until dialysis is required. Liver failure can cause life-threatening complications like bleeding or infection. All of these conditions announce their presence early, often with swelling. To ignore it is to ignore your body's distress signal. Let's use a simple analogy. Imagine your house has a leaky pipe. At first, you see just a small puddle in the corner. You wipe it up and think nothing of it. But every day the puddle grows. Eventually the water seeps into the floorboards, damaging the entire foundation. Swelling is your body's puddle. It may look small, but it points to a leak in the system. Address it early and you prevent disaster. Ignore it and the damage spreads. What should you do if you notice unexplained swelling? First, pay attention to patterns. Is it worse at night? Does it improve after resting with your legs elevated? Does it keep coming back day after day? Second, seek medical advice. Even if it turns out to be something simple, like a temporary reaction to medication, it is better to know. If it is something serious, early treatment can make all the difference. Treatment depends on the cause. For heart failure, medications called diuretics can help the body expel excess fluid, easing both swelling and breathing. For kidney disease, controlling blood pressure and blood sugar is essential. For liver disease, reducing salt intake and addressing the root condition is key. But in every case, the first step is recognizing swelling as more than just water weight. It is a message. In conclusion, unexplained swelling is not just cosmetic. It is your body's way of waving a red flag, saying, "Pay attention, circulation is not normal." Whether the cause is heart, kidney, or liver disease, the symptom deserves respect. Ignoring it could mean allowing silent damage to progress until it becomes irreversible. Respect the signal, act early, and protect your health. Don't forget to subscribe to the channel to see more videos about your precious health.